According to our top story this morning, we are watching the number of COVID patients in Georgia's hospitals closely rise. Those numbers ticking back up again.
They're not as bad as they were this time last year, but last year we were seeing about 2,000 people in the hospital every day, but the numbers today are still telling an important story. We have Mara Siriani in the studio with us this morning. Talk to us more about what we're seeing here and what it actually means for people living in the state.
Yeah, so COVID is showing some similar patterns. So kind of what we saw at the beginning of our winter surge last year, but the difference is this time around, thankfully, we have these vaccines. So right now, Georgia's seeing about 83% of its hospital ICU beds in use. Now, in and around Cobb medical facilities, that's the number. It's about 90% higher, and you see it there, the region N on your screen. Fulton, DeKalb, and Gwinnett counties are at about 81% capacity, and so far, 2 hospital regions, including areas like LaGrange and Augusta, are already maxed out. But Wednesday marked the 3rd day in a row that Georgia is dealing with more than 1,000 COVID patients. Experts say the vaccine's still going to be our best defense against the most serious COVID symptoms, hospitalizations, and deaths.
I hope that this news that's now spreading out about the Omicron variant and the vaccinations are going to get people to reevaluate, go get boosted if you're vaccinated, and go get vaccinated if you're not.
Georgia COVID patients only make up about 6% of all hospital patients. And just for some perspective, the CDC says that 20% and higher is considered a serious strain on our medical staff.
Yeah, and Mara, people are really urging others to go get the vaccines to help fight these numbers. Thanks for that report. Speaking of new numbers, they are showing 25% of adults across the nation have gotten a booster dose of the vaccine. That's about 48 million people. And now health experts are recommending boosters for adults to help protect against new variants of this virus. Dr. Fauci says healthy kids aged 12 to 15 have a better immune response than adults. That means the vaccine's protection could last longer in that age group, longer than 6 months. Last week, Pfizer asked federal regulators to approve a booster dose for 16 and 17-year-olds. It's a decision that could come down in the next 2 to 3 weeks.